İngilizce kanalındayım. This is the English channel for test purposes only. English channel test purposes only. So I'm on the English channel right now for them to hear. This is English channel for test purposes only. We'd like to welcome you all to the Antibiotic Awareness Week Symposium. Ladies and gentlemen, we will soon be starting our event titled Antibiotic Awareness Week Symposium. And this event is co-organized, it's organized by the World Health Organization Europe, World Organization of Animal Health, Food and Agriculture Organization of the United Nations, the UN FAO. This is English channel test purposes only Antibiotic Awareness Week Symposium, organized by World Health Organization, World Organization for Animal Health, UN FAO. And the target audience for this event will be the government officials working on veterinary, agriculture, and health sector, including provincial teams, healthcare professionals, including physicians, nurses, pharmacists, dentists, veterinarians, environment and food engineers, pharmaceutical industry, and academicians working on AMR, food safety, and One Health. English channel test purposes. I understand that it's clearly heard, therefore I'm giving an end to the speech.
Tekrar günaydın. Ben şimdi hem Türkçeden İngilizce çeviri oluyor mu kısmı ile ilgili bir deneme yapmak istiyorum.
Tamam. Now I'm in the English channel. This is the interpreter speaking from the...
This is English channel number. This is the channel number. This is the channel English for us to be able to hear the English translation. I will be greeting the panelists in Turkish.
Trying to work on the interpretation sessions, and I hope that you can hear my voice from the Turkish channel and also Arabic channel. If you could write me in the chat box if you are receiving my voice both in Turkish and Arabic. Thank you very much. Sanırım saat 10'da başlayacağı için herkes dinleme şeyine geçmemiş olabilir. Evet, tamam. Çok güzel. Teşekkürler. Saat 10 itibariyle toplantımıza başlayacağız. Muhammed Bey bir yorum yazdı ama İngilizce konuşana kadar çeviri geliyordu. Şu an gelmiyor. Musa Bey kontrol edebilir miyiz acaba? Ben isterseniz tekrar İngilizce konuşayım. Türkçe kanaldan çeviri gelip gelmediğini tekrar şu an gelmiyor. Muhammed Bey, Zoom'unuz güncel mi acaba?
Hemen ilgileniyorum o zaman.
Zoom'unuzu güncellemeyi bir deneyebilir misiniz? Danilo Bey'i de panelist olarak alabilir miyiz acaba?
Good morning, Melda.
Danila, good morning. Can
Good
you
morning,
hear?
Melda.
Oh, I can hear you at least. Good.
Oh, very good, very good.
Good morning.
Camera also.
Hi, Danilo. Good morning. I was trying to handle the panelist authorization, and
Okay.
I think now there is no problem. And also, I can see the Dr. Batir Bey here, and we are waiting the representatives from Ministry of Health and Ministry of Agriculture. If you give me in 5 minutes, I will try to communicate with them. Thank you.
yapalım. Merhaba.
Hello, everyone.
Melda Hanım merhaba.
Miss Melda.
Sesinizi duyuyoruz.
Hello, we can hear you clearly, Miss Gonca. Thank you so much. Mr. Bekir Keskin Kılıç Bey, we're going to be waiting for him, Mr. Bekir. The minute he arrives, we will be starting very soon. I will be turning off my microphone.
Tamam, teşekkürler. Sağ olun.
Thank you so much.
Dear participants, I think we can start our meeting because I see all the panelists and speakers. So if you allow me, I would like to start our meeting. Distinguished Director General, representatives of the government of Turkey, members of the academia and participants. It is our great pleasure to welcome you all in this very important event. And as many would know, World Antibiotic Awareness Week is a unique and annual opportunity for us to put the spotlight on our joint responsibility for ensuring the protection of our antimicrobials. Today now we are all together from various sectors under the One Health approach. As known, working together with One Health framework is an essential component for tackling AMR. Also in these pandemic days, we have reminded that we, human, animal, environment, are all connected to each other. Today, with the valuable contribution of our speakers, we will discuss AMR from health, agriculture, and animal perspective. We would like to thank Ministry of Health and Ministry of Agriculture and Forestry for their all continuous support. Now, I would like to give the floor to Mr. Bekir Keskin Kılıç for delivering the welcoming address on behalf of Ministry of Health. Dear Keskin Kılıç, floor is yours.
Thank you very much. I'm so sorry. I think I'm the last one to join you. And I have realized that a little light problem. But our founder of our republic says that it's not important to see me, but it's important to understand me. I continue in my own language, if you let me. Öncelikle bu organizasyon için çok teşekkür ediyorum.
Thank you so much for this organization.
Açıkçası içinde
First of all,
bulunduğumuz
if I
dünyada
may emphasize, in the world that we live
reel
in
anlamda
the real
bulaşıcı
term,
hastalıklarla
this
mücadele
contagious and
edebilmek için
all the
elimizdeki halen en
communicable
önemli
disease,
silah antibiyotikler.
we have this
Ve
great
antibiyotik
special
direnci bu şekilde
means to
arttığı
fight
müddetçe
against
de
this communicable
bu
diseases. We have the
mücadeleyi kazanabilmemiz gittikçe
antibiotics, and with the
zorlaşıyor.
AMR,
Çünkü bir
with the
taraftan da
problem, this is
sadece
becoming more and
antibiyotiklerin
more difficult.
etkinliğini
It's not only the efficiency and efficacy of the
azaltmak ya da kaybetmek
antibiotics,
sonucuyla karşılaşmıyoruz. Bir
we're not
taraftan
only
da
seeing this
yeni
problem of losing
antibiyotiklerin,
the
yeni güçlü
efficacy
antibiyotiklerin
of the
üretiminde ciddi bir problem olduğunu hepimiz
antimicrobial,
biliyoruz.
but also we know
Hal
that
böyle
there's a problem
olunca
in the
elimizdeki
manufacturing and
silahları doğru
production,
kullanmak,
manufacturing of the new
mevcut antibiyotiklere yönelik direnç gelişmesini
biotics.
engellemek için
So in order
akılcı
to
bir
reduce down
şekilde
the AMR,
kullanımı
we need to go with the
düzenlemek son derece
rational
önem
use, and
taşıyor.
it's of high
Ve
and very critical
burada da
importance to have the rational
açıkçası
use of the
Dünya
AMR.
Sağlık Örgütü
And
ile
here
FAO'nun
with the
işbirliği içerisinde
WHO
OIM'in
and
de içerisinde olduğu
UNFAO, and there's
bir
the World
organizasyonun
Organization
tek
for
sağlık
Animal Health,
kavramında
the
birleşmiş olması son derece
Tripartite.
kıymetli.
This is of great
Ancak bu şekilde biz
value that
antibiyotik
these
direnci
three
için
organizations are
reel ve geçerli bir
having this
mücadeleyi
cooperation
yapma şansına
to fight
sahibiz
against the
ve o
AMR
sonucu
and
alabilme
as this
şansına sahibiz. Bu
tripartite
anlamda
working group. And we
elimizdeki
have the chance
bilgileri
to
gözden
strike in
geçirmek,
confidence and to go
yeni
through what we
işbirliği
already know
fırsatları
and to
oluşturmak,
create new
bu
opportunities for the
noktadaki bilinci
cooperation
arttırmak ve
and in order to
kullanıcıların
increase the
katılımını
awareness, antibiotic awareness on this and
güçlendirmek için en
in order
önemli
to strengthen the
araçlardan birisi bu tür
participants and
toplantılar.
those
Biz
who are
hem bu
involved as
toplantı
the stakeholders.
sayesinde
It's only through
yeni
these
şeyler
events
öğrenmiş
and
olacağız,
meetings that we also get to
öğrendiklerimizi
learn
tazelemiş
new
olacağız ve bir kez daha
issues,
kararlılığımızı
points,
ortaya
and
koyma fırsatı
not only
olacak.
that, but we will be
Ben bu
refreshing what we
anlamda
already
toplantının
know, and we will be
organizasyonunda emeği
expressing
geçen
ourselves.
herkese
And therefore,
teşekkürlerimi ve
if I may
minnetimi
just
ifade
extend
etmek
my
istiyorum.
gratitude to everyone who make
Toplantının
this event
ilgiyle
possible.
takip
And
edenlerden
I
olacağım.
know
Çok
that
teşekkür ediyorum.
this will be followed with utmost attention, and I will certainly be one of those participants.
Great pleasure to work with you in various areas, including an AMR. Now, I would like to give the floor to the Ms. Gonca Öztap for delivering her welcoming address on behalf of Ministry of Health and Ministry of Agriculture and Forestry. Sorry for mistake. Floor is yours, Gonca Hanım. Thank you.
Merhabalar herkese.
Hello, everyone. Esteemed participants, on our behalf of Ministry, I would like to greet you all and our Director General and they and other representatives. They had to attend another meeting. Therefore, this tripartite meeting, I'm sorry, I cannot hear them. I cannot hear them. Oh, sorry. I have been attending all the previous meetings on this very topic. I'd like to extend my gratitude to everyone who've been making this event possible in order to increase the antibiotic awareness week symposium. As you know, with the COVID-19 process, we have already been focusing on the increasing importance and based on the law of the veterinarian and the plants, and there are many different antibiotics and AMR related studies undertaken by our ministry. And in our country, there's this total number of 1,851 that can be marketable, and 800 and they are made of antibiotics, and they have been those who have been prohibited are in line with those that have been prohibited in Europe. It's only for the treatment purposes, and they are all prescribable, and they are subject to being prescribed. No antibiotics is allowed to be sold without the prescription. And by the monitoring, there's this e-prescription and the electronic prescription and the medicine electronic surveillance. This was also in the practice starting as of 2018. And as of 2019, August 15, there's the vaccination monitoring and tracing as well. So we have all these systems, electronic systems. And with these electronic systems, starting as of the manufacturing of the antibiotics and till the use of these antibiotics for the animals, we are able to monitor this. And especially for the residues and to eradicate the residues of the food, we have another connection. And for the residue following and residue monitoring, we have the sample taking, we have the sample taking from the slaughterhouses. We are also following the residues of the or other antibiotics, and there's this inspection of the antibiotics in the new locations as well, under the concept of single health. And with the approach that has been displayed by our ministry, we're always eager to be part of all these studies. And if I may just add, there's a strategy and AMR and the strategic action plan we have been also part of. And and also for the animal health. There was another title for the animal health and the use of antibiotic and inspection and taking under control the use of antibiotics for the animals, for the veterinarian site and all the other veterinarian practices. This will also be arranged under this title. This in relation to the action plan and following the action plan, there are a number of different steps we have undertaken. One of them is the AMR, monitoring and surveillance, and there's this national project on the veterinarian use of the antibiotics for the poultry animals and for the fishery and for the cattle, and we collect the isolates and we identify this, and for in a total number of 35 different antibiotics, we try to identify their resistance. And this project right now is continuing. As once this project comes to an end in the food and on the other animals that have the value of the food, we will be determining and identifying the AMR level, and therefore we can go with the sustainable project and sustainable. And with the Ministry of Health and with the cooperation we have with the Ministry of Health and WHO, we have there's this national action plan for the AMR, and there was the workshop for the budgeting, and we have also attending this budgeting and costing of the NAP and all the other. We've been also very much closely following all the other studies undertaken by the World Organization for Animal Health and all these actions and activities undertaken by the Tripartite working group, where we are all very much pleased to be part of the activities in order to increase the awareness. And we definitely believe in the benefits and the use and the value that all these actions will bring under this working group. I would like to greet you all on behalf of myself and on behalf of the ministry that I represent here, with my full belief and firm belief that this tripartite working group will bring us the best result.
Please. Thank you very much. And also working together with the Ministry of Agriculture and Forestry, together with FAO, is very beneficial for us, in addition to the Ministry of Health. Now, with this opportunity, I would like to kindly introduce you Dr. Batir Berdiklichiev as Head of Country Office and WR, who has assumed his duty on the 1st of November. Now, I would like to give the floor to Mr. Batir Berdiklichiev for delivering the welcoming address on behalf of WHO. Dr. Batir Bey.
Thank you, Melda. Distinguished Director General of Public Health, representatives of the Ministry of Agriculture and Forestry, esteemed colleagues from the Food and Agriculture Organization, World Organization for Animal Health, WHO Regional Office colleagues, dear participants and partners. I'm truly honored to welcome all of you at today's symposium, which is conducted as the joint event of Tripartite Working Group. And I see that we are more than 220 participants already. To reflect the full range of life-saving medicines that face the challenge of resistance, previously World Antibiotic Awareness Week has been renamed this year to World Antimicrobial Awareness Week, and it will last from today till 24th November. The focus of this Awareness Week this year is on stopping worsening the ongoing antibiotic resistance crisis due to COVID-19 pandemic. Currently, literature suggests that only 8% of hospitalized COVID-19 patients experience a bacterial or fungal infection, and yet 72% of these patients were administered antibiotic treatment. These figures speak for themselves, and very likely that such practice will unfortunately lead to a further development of resistance and may also lead to shortages of medicines for those who really need it. World Antimicrobial Awareness Week is a unique opportunity to emphasize our joint responsibility and commitment to preserve antimicrobial efficacy so we could treat infections now and for future generations. While governments rightly focusing on containing COVID-19, it is important not to lose sight of the ongoing and longer-term serious threats of IMR that will reduce our ability to treat infections. We cannot allow the COVID-19 pandemic to cause an IMR catastrophe. A multisectoral One Health approach is needed to tackle IMR. A One Health means everyone is doing their part in the fight against IMR. Antimicrobials must be used responsibly in the human health sector and equally in the animal health and agriculture sectors. I'm very glad to announce that we have a tripartite working group established in Turkey, which includes representatives of the WHO, FAO country office, and World Organization for Animal Health Turkey representatives. Together with the representatives from the Ministry of Health and Ministry of Agriculture, with the aim to enhance intersectoral collaboration in Turkey. The fight to keep antibiotics working cannot be won by the health sector alone. It requires collaboration of many sectors, partners, and the public. And with this opportunity, I would like to thank all our partners who are contributing and supporting us to make this event a reality. And we are very much looking forward to work with all of you to protect our health. Thank you very much again.
Thank you very much, Mr. Batir Berdikliçiyev. Now, before giving the floor to Mr. Viorel Gutu, we would like to thank FAO's collaboration and cooperation in many areas in national level and for many years. Now, Mr. Gutu, the floor is yours for delivering the welcoming address on behalf of FAO. Thank you.
Thank you very much and good morning. Thanks a lot for your kind words about FAO. Dear Director General, distinguished Director General, colleagues, representatives of the government, colleagues from FAO, OIE, and WHO. It's a great honor to address you in my capacity as FAO representative in Turkey, but also sub-regional coordinator for Central Asia, regarding the important health risk on antimicrobial resistance at the animal-human ecosystems interfaces. But before I go ahead with my intervention, I'd like to sincerely welcome Batir Bey for joining us in Turkey very recently and wish a lot of success in this very important mission. Hoş geldiniz. Now, coming back about our symposium, I'd like to mention that it's not only an important opportunity to share the latest initiatives on IMR, but by our organizations. It's a chance, it's our opportunity to see Turkey's progress to align with the efforts to tackle AMR. To begin with, let me express my basic takes regarding the focus of our event. First, AMR strongly reminds us that connection between human beings and animals is unbreakable, unavoidable, and indispensable. We are sharing the same ecosystem with animals. Bacteria, parasites, viruses, and fungi affect both animals and humans. Second, local and national level remedies to eradicate AMR fall short of efficiency, given the fact that spread of bacterial viruses is irrelevant to geographic or administrative borders. Thus, a global, multisectorial approach is a prerequisite to fight against AMR. Within this scope, the role of international and regional organizations and NGOs should not be overlooked. FAO, OIE, and WHO's work in addressing risks at the human-animal ecosystems interface and the tripartite concept note, which was laid down in 2010, are instructive for all of us in sharing responsibilities for health risks such as AMR. Dear colleagues, as AMR is a growing threat both to animal and human health in global scale, we need to devote collective effort in containing and mitigating the cost of it. Prolonged illnesses and increased mortality are the first to come to mind, but we should also be aware of the fact that AMR has wider negative ramifications on society that deserves close attention. I believe that targeted efforts, such as European Programme of Work and tailored support such as One Health approach, are scaling up our endeavors to pressure AMR. As part of this struggle, FAO's role includes, but not limited to, confront the challenges posed by antimicrobials in agriculture and aquaculture. We are also ready to support our counterparts' work in other key actionable areas in order to reverse current trends regarding AMR. I am pleased to see Turkey's alignment with the global struggle against AMR. Turkey has already an infrastructure, and it was already mentioned, at its hands, such as e-prescription system, veterinary medicine track and trace system, and veterinary medical biological product tracking system, and many others. All these systems, which are integrated to each other, would support Turkey's initiatives to contain AMR. I believe that Turkey Tripartite Working Group collaboration with the ministries in the country will pave the way for exchanging information between Turkish authorities and relevant international agencies. This exchange in turn would be fruitful to overcome AMR in Turkey. And I'd like to mention that not only in Turkey, I believe that Turkish experience should serve an example which can be extrapolated to and implemented in other countries. With all of this, I'd like to wish a successful symposium, and I have strong conviction that our collaborative work in addressing health risks will bring a lot of successes on different levels in the country, in the world, and to all of us. Thank you very much, and again, good success to the symposium.
Thank you very much, Mr. Gutu. Now we are starting our presentation part with the first presentation from Dr. Mario Latini from OIE. He will inform us about the OIE initiatives and activities on AMR. Now, floor is yours, Mr. Latini. Thank you.
Thank you. Good morning to everyone. I'm going to share my screen. Do you see? Yes.
Can you please share again?
Okay. How you see the my presentation is what is here? Okay, here we are. Is about an initiative and activities on AMR. The OIE is working under four objectives that are awareness, knowledge, good governance, international standards. This is the strategy that OIE has for combating that antimicrobial resistance. All these objectives are under the control of OIE AMR network that is related, is based, of course, in the headquarters in Paris, but even people from regional and sub-regional office are part of that. What about the objective one, improve awareness and understanding? Well, this is the most important part of what I think. There's a lot of activities that the OIE is doing. How you see is promote awareness of AMR, involving to make target communication, encourage the adoption of measures that reduce the use of antimicrobials. Is involved, of course, workshop, conference, and symposium like this. Encourage a professional culture that supports the responsible and ethical use of antimicrobial products in animals. That's a very important part. And biosecurity, vaccination, and husbandry is very important because, of course, the health animals means less use of antibiotics. And how you see that part of the strategy is the collaboration with the other organizations, WHO and FAO, the main. And about this objective of this strategy, there is the campaign "We Need You." That is, we produce a lot of materials like leaflets and posters to share with stakeholders. The stakeholders are veterinary service, of course, veterinary students, veterinary practitioners and farmers, and there is even a specific request to these stakeholders, like one that is very important, that especially in developing countries, is the use antimicrobials only when prescribed by veterinary, and of course use antimicrobials in a right way, meaning the correct dosage and correct time, because we know that antimicrobial resistance is even worse when we use low level when we use antibiotics in a wrong way, like only for 2 days or for with a low dosage. Other stakeholders involved are policymakers, of course, and pharmaceutical industry. How you can see, all the leaflets that OIE produce are more or less similar but targeted for the stakeholder. So there are some difference that in comparison with the stakeholders, just to make our message better. And the other stakeholders that are involved are wholesale and retailer and feed manufacturing. How you see, all the veterinary sectors are involved in this "We Need You" campaign. And for this, we produce a lot of posters with all animals, all you see, all the zootechnic animals, even pets, because even dogs and cats can create antimicrobial resistance because they are when the treatment are not correct. And one part, even for that now is going to increase, is the fisheries, not fisheries, aquaculture sector. So that in Turkey is one of the main, is a really important production. This is, I want to show how this awareness can go. This is not our producer, this is the Ministry of Health of Malaysia. And how you can see that when you involve all the stakeholders, even policymakers, even the social society, you can have something like this. That's something like, it's not a marathon, it's just 5 kilometers. And then this is for going to aware the right antibiotic use, yes? So this first objective for OIE is very, very important. The second one is strengthening knowledge through surveillance and research. And of course, we need to develop and implement monitoring and surveillance system. To have a database, we have the WISE, that is a system that give the information of animal health situation in every country. And once again, everything should be in a partnership with WHO and FAO. That is a very, very important thing. That is, was already said that to contrast the AMR cannot be done by one sectors alone. We have the report of annual report on antimicrobial agents intended for use in animals. We have already the 4th report, but we are already launched the 6th round of antimicrobial use data that have the first deadline in a few days, in 2 weeks. And everything go to a database that is inside the OIE headquarters and is very useful to understand what is going on in every country. And we have even the OIE list of antimicrobial agents for veterinary importance. You see how is built. We have the antibiotics, the species for where you can use these antibiotics, for what are you using, and the importance of these antibiotics. The FCIE means the critical, it's very important, and VIE just important. So, and that's for every antibiotics that you can use in veterinary. As a first objective, we have support good governance and capacity building, and more or less is support the development and implementation of national action plans that, of course, is under the more or less under the WHO control, but of course OIE is doing its part. And everything is built in every country with the focal points on veterinary products, that is on the veterinary sectors. And of course, another thing that's very important is to support and to develop and modernize the legislation in every country. This is the situation in national action plans in Europe, in the Europe region, and the green means that there are very good situation, and the other is developing situation to implement the national action plan. And how you see the majority, there is a good situation, means that how you see is more or less in a lot of countries, and but the best things is that this situation is improving every year, and so this is a control that, of course, this is I say that is under WHO, but is a very important that this is a tripartite issue that everyone do his part. Fourth objective is encourage implementation of international standards. This is very important because the situation can improve when you implement international standards. Once again, the collaboration with WHO and FAO is very important. And OIE has two health codes, one for terrestrial and one for aquatic animals. And there is a lot of chapter that's speaking about antimicrobial resistance, antimicrobial use, and the responsible and prudent use of antimicrobial agents in veterinary medicine. So to use the international standards is one point that the OIE is really stressed. At the end, I speaks about a little bit of a multi-partner trust fund. This is a tripartite fund that with the WHO, FAO, and OIE that are supporting and are funding project in every country for antimicrobial resistance. And I was really involved in Tajikistan one, with One Health capacity building to support priority action for combating antimicrobial resistance in Tajikistan. And just to see that the output of the, more or less, this is just an example, every project is different, but how much, a lot of the output of this project are inside the strategy that I already showed. Is the surveillance of AMR, laboratory training, the monitoring for the use and the consumption of antimicrobial, to strengthen the system for optimized use, implement standards for biosecurity, awareness campaign. This is so this project is following the strategies of OIE, and not only of the OIE, of course. And one thing that I would like to summarize for my intervention is that I worked 20 years in laboratories doing antibiogram. And the panel of antibiogram of veterinary sectors is between 30 and 50% exactly the same that you have in medical sectors. This is why we need to work together. So it's we use at the end the same antibiotics. And one thing that I would like to share at the end of the day, even on the regional level, we are producing a workshop and my region, the European region, is on the 23. In 5 days, we will have another in tripartite, because we are WHO, FAO, and OIE together, making a symposium more similar of this one. So this is very important that awareness is, and this symposium, this workshop are very important to stress the AMR problems, especially after the COVID situation. Thank you for your attention.
And thank you for this very comprehensive presentation, Mr. Latini, and emphasizing the importance of tripartite work. And we hope that in next coming years, there will be more opportunity under the tripartite in Turkey as well. Now, I would like to give the floor Dr. Danila Lofo-Wong. He will give brief information about the AMR activities of WHO, both regional and national level. Thank you. And Dr. Lofo-Wong, the floor is yours.
Thank you very much, Melda. And dear esteemed colleagues and colleagues all around Turkey, thank you very much, first of all, for having me. It's a great pleasure to be part of the World Antimicrobial Awareness Week seminar, which seems to be a reoccurring theme. I was also part personally last year, and hopefully next year we will be able to be there in person again. But for now, we have to do with what we have, and it's nice to see some of you. It's great to see the amount of attention and the number of participants that it's getting in Turkey, which is also has been like this for many, many years, which also shows the long history of Turkey to be concerned and dealing with antimicrobial resistance. Now I'm going to share my screen also to give you my presentation. I hope you can see this.
Yes, we can.
Very good. Let me just go in presentation mode. So for those of you who do not know me, my name is Danila Lofo-Wong. I'm the regional advisor for antimicrobial resistance at the WHO Regional Office for Europe. And I will just give you a little bit of an overview of the kind of supporting activities that we're doing around the region, but also with Turkey. So the work that we've been doing has been based on a regional action plan, which actually expired this year. It already started in 2011, so it's quite old, and it's time to update it, which we will use the rest of the year for, and then next year hopefully we will come with a new action plan, which will be more in line with the global action plan, and also building all the experience that we've accomplished over the last almost 10 years. But at the time in 2011, not the entire world was interested in antimicrobial resistance or even aware. It was largely neglected in many, many countries, also because many countries did not systematically gather data and information, so there was no surveillance. Also in a large part of our region, the problem of AMR itself really requires intersectoral coordination, which also was very difficult at the time. It was well recognized that it spread through international travel and trade, and it was realized that there was a need for international standards and for data collection and also sharing. So the year after the adoption of the action plan was a year of traveling to the countries in the region where we did not have a lot of information. And through those assessment missions, we started up with a lot of very practical activities to help address antimicrobial resistance. So one of the areas we were working in was policy support. Like the other international organizations, as neutral outsiders, we can convene different sectors at different meetings. So we had a series of national stakeholder meetings where we would bring people together from different sectors with different responsibilities to give them a common understanding of the issues and also to start thinking about what is their role in addressing antimicrobial resistance. We also aimed to have these meetings formalized in intersectoral coordination mechanisms. So we facilitated this work in countries, also by providing terms of reference, by guiding on who should be around the table, etc. And of course, there was a big focus on developing national action plans. National action plans is an opportunity to collectively find out what is being done, what needs to be done, and what is still missing, and who is responsible for these actions. And also more recently, we have been helping, supporting member states by making evidence-informed policy briefs, basically by translating research results into policy decisions. But also with our sister organizations, FAO and OIE, we've held several policy meetings where we would invite a number of countries to discuss both the development and the implementation of their action plan, and basically make a platform for the sharing of experience. We also developed a lot of resources throughout the years, lots of different protocols and manuals, templates, tools, and also instruction videos. In addition to that, we have also the human resources that we were able to share with member states and help them in their country through consultancies or experts. But also we have many, many good partners that we work together with, in addition to FAO and OIE, such as WHO collaborating centers and other renowned institutions. Of course, with the absence of the interest in antimicrobial resistance in the beginning, there was a lot of things that needed to be learned and taught. So we had a lot of, and still have a lot of training and capacity building in the areas that are mentioned here. Antimicrobial stewardship, of course, extremely important to make sure that the right drug is administered at the right time to the right patient, etc., for the right duration. Infection prevention and control, extremely important also, as prevention is always better than cure. And I think you may have heard it many times before, but each infection which is prevented is one that doesn't need treatment. And that may be a very well used quote, but it's still very, very true. Of course, as we also heard from Mario earlier, the laboratory methodologies, they have developed, but the antibiotics we're looking at are still the same, but they need to be standardized. So we need to be able to compare results between laboratories, between countries, between parts of the world. But also it's important not only to gather information, but also to collect it, analyze it, and make sense of it. So we also train in data management and analysis. And finally, or not finally in this list, one of the things that of course is also generally recognized is that awareness itself is not enough to change behavior. So we also now, since the last few years, have liaised with anthropologists, behavioral scientists to try and understand behavior and thereby be more targeted in our approach to not only convey information, but also to help people use that information and act upon it. We also have a lot of research and projects going on, and these are mostly just demonstration projects to show that, to show member states and our colleagues in countries that some of these things are not theoretical, they actually work in your context. So we start out small, then hopefully these elements will be made widely spread throughout the country. And as I also mentioned before, one of the realizations for the initial action plan was that many countries were not performing surveillance. So they were not collecting data and information on a routine basis in a big part of the region. So we also initiated some surveillance network activities. The main one that started in 2011 is the Antimicrobial Medicines Consumption Network, which is a network that is covering those countries that are not inside the EU and not part of the EU medicine consumption monitoring systems. It's a network with a lot of experience since 2011, basically. The other side of the coin, if you will, is the Central Asian and European Surveillance of Antimicrobial Resistance Network, also called CSER. And this, similar to the AMC network, is targeting those countries that are not part of the EU, that do not have an established surveillance system. Although some of the countries that were previously part of a network before the EU network, including Turkey, joined our network early on and could provide data internationally to and share their experiences. So we're very happy with Turkish participation already from the very beginning when CSER network was started. In terms of antimicrobial stewardship, there's actually quite a difficult concept to convey still for many countries and to implement in healthcare settings. 2 years ago, we launched this online course at the Open WHO site, which is linked here, and it's called Antimicrobial Stewardship, a competency-based approach. And it turned out that we really hit a niche of a need because many people, more than 50,000 professionals have signed up to date from 174 countries. So we really tapped into a need which was out there. But also we have more targeted stewardship courses in countries, and we've also started a number of pilot projects. And going back to the policy briefs that I mentioned earlier, we together with the global network from WHO called EVIPNet, which stands for Evidence Informed Policy Network, we are using their methodology to develop policy briefs in the area of antimicrobial resistance. And it basically starts out with courses of a policy brief team in a country, and we bring them to a workshop to basically teach how you develop policy briefs. Because one thing is, of course, is gathering all the information, but it has to be formed in a way that it's understandable to policymakers, and they truly understand what the consequences of a policy choice. So, and the policy choices are coming out of the policy brief, which are then discussed in policy dialogue meetings. And then one of those policies, or one or more policies are chosen and implemented. We've already developed a number of these policy briefs in the countries mentioned here. And we have another number of countries ongoing. We will start the third cohort as soon as we can, maybe already during the COVID crisis or soon thereafter. Also, the core components of infection prevention and control is very important, as I mentioned before. And there are these 8 core components, which we also provide both guidance and training. Another activity is that we are pushing the so-called AWARE classification, which is basically a classification of antimicrobials from the essential medicines list into an access, watch, and reserve category. The access category are those first and second line antibiotics that need to be made available at all times of high quality and at an affordable price. Because these antibiotics have the least potential to generate resistance. Then the watch category is that category of first and second line antibiotics that have a higher potential of becoming resistant. So it should only be used on very special indications. And the reserve category, as the name indicates, is only reserved for those last resort cases with the treatment failure of multi-drug resistant antibiotic infections. Now, part of the campaign, and based on research, is saying that if 60% of all antibiotics consumed are in the excess category, then we have a good chance of maintaining prudent use. So this is the target by 2023. And some of the activities specifically in Turkey, as I mentioned earlier, Turkey was one of the first members in the AMC network and has been collecting antimicrobial consumption data for many years. This graph is maybe a little bit small, and I apologize for that, but it's showing a distribution over the years between 2013 and 2017 in Turkey. And you see the distribution itself is rather stable, but you see a very promising downward going trend, which I'm sure is continuing in the years after 2017. But what I really wanted to share with you from the report before is the proportion of use that is in the excess category. You can see that throughout the years from 2013, 49% was in the excess category, 2017, 54. So Turkey is very definitely moving towards the 60% target that I mentioned earlier. which is very, very good and should be applauded. Turkey is also, as I mentioned before, one of the first members of the CSAR network measuring antimicrobial resistance. This is a map from the report that will come out today, actually in 7 minutes, so it will be launched. And again, Turkey has been providing data to this report ever since we started in 2015 with the publication of the report itself. And again, depending on which bug-drug combination you look at, the color which represents the prevalence of a bug-drug combination that changed in country, but also over time. As also was mentioned during the introduction today, Turkey was a pilot country for a case study on costing and budgeting of national action plans. And it's not a coincidence that we chose Turkey, because Turkey has all the prerequisites for a successful pilot project. Of course, if you want to try out something, you want to go somewhere where the chances of success are good, which is in this case in Turkey. A lot of the data that needed to go into this costing and budgeting project was available, but the project made sure that it was made available in one place. And the aim of the project, of course, is to support countries in costing and budgeting their implementation plans. Because what we see with national action plans is that there are many plans born without a budget or without any sense of what resources are needed to implement the plan. And of course, this is very important to have an idea so you can turn plans into actions. Another case study, and again, not surprisingly that we go to Turkey, is what we will be working on, a little bit delayed due to the COVID crisis, but we are looking for Turkey and the abundance of Turkish data to start estimating the burden of antimicrobial resistance. So one of the main objectives of this project will be to estimate the attributable deaths and disability adjusted life years of selected antibiotic resistant infections in Turkey. And related to that, we want to estimate the economic costs that are associated with resistant infections, first in Turkey and then also in other countries of the CSAR network. Finally, we want to develop quantitative tools to support cost-effective interventions aimed at AMR prevention. Excuse me. So, but as was mentioned, today is the first day of the World Antimicrobial Awareness Week. And similar to our colleagues in OAE and FAO, we also developed quite a lot of materials. As mentioned before, you will see, for those of you that have followed the campaign closely since 2015, that we changed antibiotics with antimicrobials to indicate a broader range of related issues. And also the dates are now fixed every year between the 18th and the 24th of November. And on the left-hand side of the slide, you see an infographic which outlines how AMR and COVID are related and basically what to be aware of. Then we have also a number of social media tiles that are shown here. Some of them are related to antibiotics and COVID. Some of them are related to One Health. And we also have additional materials related to hand hygiene, etc. We also have relaunched some videos that are showing basically what to do against influenza, but then not taking antibiotics. And these are also available online, and hopefully you will see them during the campaign. Another thing we've been working on is also to start the narrative around antimicrobial resistance. We keep saying it's a cross-cutting issue, which absolutely it is. But we wanted to start describing how it links to some of the other major issues that are of people's concern. And we made these two-page leaflets that are also available online. And upon request, of course, can be translated to Turkish or any other language. Some of the important issues, for example, is how AMR and food safety are connected, or cancer and cancer treatment. What does it mean to the health workforce? What does it mean in migration, vaccination, the gender issues around AMR, etc. We're also launching some new products. One of them is related to behavioral insight on your left, what we call tailoring antimicrobial programs. It's a short guide to help set up behavioral insight campaigns, which of course we in the future will want to help member states develop and build that capacity for other types of behavioral insight campaigns. We have a number of pilot studies ongoing, but now at least we have the first publication around that. On the right-hand side, we have a little practical guide or a booklet on the main interventions around antimicrobial stewardship, which also will be launched during the Antimicrobial Awareness Week this week. Then, since it is a week and there's only 365 days in the year, there's of course overlap with other world days and interests that we're also celebrating together. One of them is World Children's Day on the 20th of November. And of course, antibiotic use is very high in the child population and very much needed. But of course, we should be very careful not to overuse or misuse, particularly in this vulnerable part of the population, because in addition to the short-term effects, it may also have long-term effects. And the whole year has been a year of nurses and midwives, and we very much needed them this particular year. I'm afraid they didn't get the attention that they needed, but we are also during this week celebrating them and relaunching some campaign materials and then related to AMR, but also to be very much aware of their important role also in antimicrobial resistance. So for that, I'd like to thank attention. And again, I think Turkey is a country of champions. It's always great to be here. It's great to see the enthusiasm, and I'm looking forward to working with you in the coming years and create even more success. Thank you for your attention.
Thank you, Mr. Lofawong, and thank you for your all kind words and for all continuous support. And now I am sure that all of us really mind the importance of One Health approach when conducting all our works in our areas. And for you showed the advocating materials, and as country office, I am sure we could provide the Turkish versions of these materials and the distribution to all ministries and related partners. Now I would like to give the floor to the Dr. Daniel Beltran Alcrudo. Dr. Alcrudo will give information about FAO initiatives and activities on AMR. Floor is yours, Dr. Daniel. Thank you.
Good morning, everyone. It's a great pleasure to be here today and have such a large audience to listen about the activities that the three organizations are conducting as Tripartite. And now I'm going to focus a bit on what FAO is doing in the Europe and Central Asia region. So my name is Daniel Beltran Alcudo. I'm an animal health advisor working for the Food and Agriculture Organization. I'm a veterinarian and an epidemiologist by training. And as I said, my presentation is going to focus mostly on the activities that we conduct in the region rather than corporate activities. Of course, FAO, we do have a series of corporate activities such as FAO reference centers that support our work, action plans, a number of different tools that have been developed, manuals, guidelines, and awareness materials of different kinds. But I will be focusing on those that have been implementing practically in our region. So FAO's work focuses in 4 main focus areas. That is improving awareness, developing capacity for surveillance, strengthening governance, and promoting good practices for the prudent use of antimicrobials. And as you will see, the activities in the following slides fall within those 4. Just to mention, FAO is in a very unique situation for working on AMR. As we know, it's a cross-cutting issue, it's a One Health issue, and within FAO structure, we do have very much a One Health and cross-cutting approach. So we do have divisions and groups working on animal production, on animal health, on environmental issues, on aquaculture, fisheries, etc. So we do cover and we do interact between each other. I'm based in the Budapest office, which is the office for Europe and Central Asia. And I'll start by talking about the activities we have conducted in terms of awareness raising specifically at the regional level. As you've heard from my two colleagues before, many of the activities we conduct to raise awareness in the region, we do it hand in hand with our two main partners of the tripartite, WHO and OIE. We do try to raise awareness whenever relevant, but we do focus largely on the World Antimicrobial Awareness Week this week. And just to show you a few of the examples listed there below. By the way, those are hyperlinks, so if this presentation is later shared, you can access those hyperlinks and get additional information. So the three organizations, we have issued a joint tripartite statement last week. We will be conducting next week a high-level webinar for the whole region, where Turkey is also involved. And we also organize international conferences, such as the International Conference on Food Safety, Risk Analysis and Antimicrobial Resistance that we held last December in Moscow, again with our two regional international partners. And we also have a number of online resources that we made available for countries translated into different languages. However, we try to focus in activities at the national level. Because of the nature of our work, we focus mostly on the livestock sector. So that is the farming community, veterinary community, the private vets, the official vets, those B vets, and other people working in the livestock sector, also veterinary pharmacies, feed mills, and so on, and all those that have a role to play in antimicrobial resistance in livestock. We develop our awareness through different means. So we often work together with associations of veterinarians, associations of farmers, or associations of students. We try to focus our messages in those that are being trained now to become professionals in the near medium term. So we do conduct a lot of awareness at schools, universities, and other agricultural institutions. Just a very recent example, we produced this livestock-focused leaflet on antimicrobial resistance, which introduces the issue of antimicrobial resistance, antimicrobial residues, and like some basic guidance on like the prudent use of antimicrobials. And this has been translated into 16 languages. It was only launched last week, and now we will proceed to distribute these leaflets among our networks, among our stakeholders. The way we conduct our awareness activities are FAO offices, and they know best what's the best way to reach those stakeholders I mentioned before. So we do make quite intense use of social media and networks. We publish articles in professional journals, in newspapers, and conferences, organize roundtables, and also work on radio programs or TV programs to reach those stakeholders. FAO has developed a number of tools related to AMR, and perhaps there are two that I would like to stress. The first one is the PMP, the Progressive Management Pathway for AMR. This is a tool that helps governance in the for the food agriculture production sectors. So within this governance tool, we include both public and private institutions. from all different sectors and in a One Health approach. And this tool is basically an assessment tool that allows to identify the strengths, gaps, and action points that are needed for the country to progress and implement their national action plans. It allows also to track the step-by-step improvements in the country. It's an assessment tool that provides, as you can see on the right, an indication on what's the progress towards the final goal of having the national action plans fully implemented. So you can measure easily if conducted on a periodical basis, like how are you advancing towards that goal. And within the region, we have already conducted in Tajikistan and Kyrgyzstan, and we have another couple of countries in the pipeline. The other tool I would like to talk about is the assessment tool for laboratories and antimicrobial resistance surveillance systems, better known as ATLAS. Similar to the PMP I just presented, it's an assessment tool that allows countries to assess and improve their national antimicrobial resistance surveillance systems. So again, this is conducted through missions into the country where those key stakeholders are interviewed to better understand what's the situation of the country in terms of antimicrobial resistance surveillance. So it allows again to generate a baseline and define a stage for the specific lab of the country. So at what stage this lab is in terms of antimicrobial surveillance. It assesses the country's capacity in 5 main areas. And again, as the PMP, it identifies the steps that are needed for improvement and what could be the priority actions. And it allows monitoring the progress as the PMP through the progressive improvement pathway. And within the region, we have conducted this ATLAS approach in Armenia, Belarus, Ukraine, Kyrgyzstan, and Tajikistan already. Other FAO tools, we are currently embarked in the implementation of a survey to better understand the usage of antimicrobials in countries in our regions. So these are very thorough surveys that are directed to 4 main different groups. This is farmers of priority production systems that are selected by the country. So those production systems that are believed to be of most importance for the country and also most relevant for antimicrobial resistance. We're also addressing field veterinarians, veterinary pharmacies, and the feed mills. And these surveys are conducted through a mobile application that uses Kobo Collect as a tool. And it's being conducted in a number of priority regions and oblasts within the region. So the activity is combined with some other field activities so that we maximize resources. So we are also assessing the biosecurity level of commercial poultry and dairy farms in the region through a tool that was developed by the University of Ghent in Belgium, known as BioCheck. We are also utilizing these visits to these farmers, vets, and so on to conduct awareness efforts. So we take the advantage of those visits to distribute awareness materials, and very importantly, based on the responses we get from the survey, to already clarify misconceptions that the interviewees might have. And the third, we are taking the advantage to collect manure and milk samples that will be later analyzed, and I will talk about this in my next slide. And the main objective of this survey is to have an antimicrobial usage baseline in different regions and by the different stakeholders that I mentioned. So once we have a clear idea on how antimicrobials are being used, what are their main knowledge gaps, what are the good and bad practices, we will tailor our training and awareness approaches to fix those gaps identified. As I mentioned before, we are collecting a number of samples of manure and milk from different production systems, and we are helping to assist countries in improve their capacity, the capacity of their laboratories for conducting AMR testings. So we have developed sampling protocols for the countries. We have developed sample storage and testing protocols. And specifically for this activity that we're going to be conducting, we are going to focus on Staphylococcus and Streptococcus and E. coli for mixed samples, and E. coli and Salmonella for fecal samples. We're also helping countries by procuring equipment and reagents that are needed for conducting AMR testing. We are also assisting in data management, and we are going to be conducting laboratory trainings in each of the recipient countries to deal with the main techniques and methodologies for laboratory diagnosis. The result of this activity will be to have an baseline of the antimicrobial resistance in the region, to identify which are the livestock species where AMR is a bigger problem, and which are the production systems within those livestock species that cause a bigger problem as well for AMR. Soon after we finish with the antimicrobial usage baseline and the microbial resistance baseline, we have an upcoming activity that is going to be promoting the prudent use of antimicrobials based on those baselines. And the idea will be to promote the reduction of the use of antimicrobials through good husbandry practices, through good biosecurity, and through good animal health practices. We want to deliver a message to field veterinarians and farmers that is wider than antimicrobial resistance. I mean, after all, like the way to improve and reduce the usage of antimicrobials, it's all about having better biosecurity at the farms, respecting vaccinations of animals, keeping animals under good husbandry practices, with good nutrition, selecting the right animals for the conditions, and so on. So under this pilot project on promoting prudent use, we are going to start focusing on dairy and poultry commercial farms, which we believe are the biggest problems in our region in terms of antimicrobial resistance. We will be working with farmers and veterinarians, and we will use a number of different tools to promote this prudent use, to conduct trainings and raising awareness. So we are planning to use demonstration farms. In case you're not familiar, these are basically farms that can be used as an example of how husbandry, biosecurity, animal health practices should work. So these are like ideal farms that are then visited by farmers and veterinarians, and we can show in a very hands approach how things should be done. We are also using farmer field schools, training of trainer approaches, and farm visits to a number of different farms. And as I said, we are going to be focusing on two main stakeholders, that are the farmers on one side and the veterinarians on the others. And we will be developing very focused awareness and training materials for those groups of farmers and veterinarians. Other activities we are conducting within the region include the review and assessment of national legislation that's relevant to antimicrobial resistance and antimicrobial usage. And after these reviews that basically involve a mission to the country and interviews with different stakeholders and reviewing all the existing legislation, we produce national reports and recommendations that are shared with the country. And then we can also provide assistance to how to work on specific aspects of legislation, how to improve specific aspects. We are supporting the development of integrated surveillance systems, working hand in hand with our WHO colleagues and public health colleagues in the country. We are assisting countries in establishing intersectoral coordination mechanisms for working on antimicrobial resistance, and more specifically for the development and implementation of the country's national antimicrobial resistance plans. And we are aiming to provide regional coordination between countries and provide a forum for countries to share their experiences, practices, and recommendations. That was all for the moment. Thank you very much for your attention. I'll be happy to answer any questions you might have during the panel discussion.
Thank you, Mr. Alfredo, for this very informative and comprehensive presentation. Now we will continue our event with panel session. And before going to panel session, now you will see a question in your screens. And we would like to kindly ask to answer these questions to have a more interactive panel session. And now we have received your questions from chat box, and questions will be answered in the panel session. Now I would like to give the floor to the moderator of the panel, and you can still write your questions from chat box, and the moderator will discuss these questions and answers with the speakers. And also you can write in 3 languages the questions in Arabic and Turkish. The English versions will be delivered to the panelists and moderators. And now I would like to give the floor to the moderator of the panel session, our colleague Peter Souza Hoesco. Now, Peter, floor is yours. Thank you very much.
Thank you very much, Melda, and good morning to all of you. It's my great pleasure to participate in the meeting today. As Melda said, my name is Peter Souza Hoesco. I'm leading the Food Safety and Zoonotic Disease Program in the WHO Regional Office for Europe, based in Copenhagen, in the same office as Danilo, the previous speaker. So I've got the pleasure to moderate the Q&A and panel discussion that we will have from now until noon time. And we have already received quite a few questions in the chat, and we have made a little list so we can start with some of them, and then we can take more as they come in. But one of the first issues that was raised in the chat is the issue about the public demand or request for antibiotics and the pressure that patients and maybe also veterinarians put on the health system and request for antibiotics. So there is kind of an expectation, as I understand it, for antibiotics to be prescribed by doctors and possibly also by veterinarians. So I wanted to give that question to the panel to just begin off with the discussion. What is your views on this, and what can be done to help prevent this or reduce the demand from the public for antibiotics that are often not necessary? I don't know who in the panel who wants to start. Maybe you, Danilo, if you can give a perspective from the human health sector side, and then maybe if Mario or Daniel can add in on the animal health sector side. Danilo, can I bring you on?
Yes, sure. Thank you very much, Peter. Can you hear me?
Loud and clear.
Very good. Well, there's of course two sides to that coin. One is the amount that is being prescribed. The other one is the demand from concerned patients or caretakers of patients. I think there's the main thing is to keep educating people about the negative effects of misuse or overuse or using antibiotics when not necessary. Because on the one hand, of course, there's the treatment guidelines that we are helping develop or that are based on local data. But as long as people are demanding antibiotics, even when it's not necessary, and have the opportunity to say, well, if you're not giving it to me, I'm going to somewhere else, or I'm getting it over the counter, as is still possible in some countries, then that's a difficult issue to tackle. So on the one hand, we need to make sure that our healthcare workers are educated and also are equipped with strong arguments not to provide or prescribe antibiotics, but also from the patient side, of course, they need to understand and accept the answer that they're getting, that in the best case scenario, antibiotics are not helping. Worst case scenario, it's actually doing more damage than good. I think I'll leave it at that and look forward to the other panelists' answer. Thank you.
Yeah, thanks, Danilo. Mario, would you like to add in also a bit here on the animal health sector side and the demand from veterinarians and the farmers themselves for the use of antibiotics in animal production?
Well, there's not what I can say about it. It is I think that we should increase awareness about antimicrobial resistance, because of course, even when I was in the university taking my diploma, we were speaking about this antibiotic resistance, and we start to speak about it. I think speaking about nearly 30 years ago, and we still don't have this issue as one of the main things for practitioners, especially, and farmers. Is all related. What is very at the moment, the only things that take antibiotic use under control in at least in the developed country is the cost of antibiotics. Yes, because farmers are really concerned how much they have to spend to give antibiotics, and sometimes they prefer not giving. Don't give it. That is can be. It helps, but it's not the right way. It's not the right approach. Of course, the right approach is using just when it is necessary. And one thing that I would like to stress in this, and sorry to say again about my experience, but in 20 years I worked in diagnostic laboratories and working with farmers, I've seen that more than half of the disease that you have in animals is because there is a wrong environment of the farmer. So how is it built the farm, how you dealing, what is your manage? That can help to have a health animals and use less antibiotics. So I think that this is things that we don't stress too much sometimes. Now there's more concern about animal welfare. Animal welfare is still a health animal anyway. And this is a point that we need to stress together with FAO, of course. We need to stress about it, because I've seen a lot of times sick animals just because there was the wrong management in the farm, and not because there is a problem, really problem. And so they give antibiotics, but they don't need it, because you then don't resolve the problems. This is the things that I think that we need to stress more, and there's not so much considered in our strategy. Over.
Thanks, Mario. Daniel, would you like to comment on this issue as well? And then we go on with the next question.
Yes, thank you, Peter. If I might complement what Mario said, I think perhaps one issue that's not familiar to the audience, because I see we have a majority of physicians, pharmacists, and nurses, is that in the animal health world, when antimicrobials are used, most of the times, the biggest amount of antimicrobials are not used to treat animals really, but they're used as what we say growth promoters. So antibiotics are given to animals, healthy animals, just to incentivize or promote growth, as the word says. So this is a very, very common practice in our region. In regions that have been working on antimicrobial resistance issues for longer, it's been a real challenge to decrease this use of antimicrobials for growth promoters, because it's been used by farmers for so long. But I think that's perhaps the easiest way to reduce the use of antimicrobials. With just eliminating that use, we would eliminate the majority of the use for antimicrobials. Also, when we are talking about treating animals in the veterinary world, it's very common that antimicrobials will be used as a preventive treatment. So even before the disease might appear, the veterinarian already is giving antibiotics to the animals. And also the issue of mass treatment, like rather than treating the individual animal that is affected, it's very common that the whole herd will be treated. So I think, as Mario said, I mean, awareness on like how to use antimicrobials properly, how to use them only when needed in the animals that are sick, rather than for prevention or growth promotion issues. I think that's only getting that message across would reduce the use of antimicrobials tenfold, perhaps. The other issue, I think, is that in our region, antimicrobials are often used without the need for a prescription from the veterinarian. So often farmers have access to antimicrobials directly from the veterinary pharmacies or even from online supplies. So again, that's another issue, because that means that often they are not being used properly. The dosage is not proper, the length of the treatment is not proper, and so on. So I think there is all these are very basic and simple key messages, but we really have to work to get them across. I mean, I think it's the way forward is very clear. It's just like making sure we manage to reach farmers and field veterinarians so that they start being a bit more careful about how antimicrobials are being used. Thank you.
Yeah, thank you for that. And definitely, I think the encouragement and the promotion of prudent use of antibiotics in both human and animal health is extremely important. So well taken. There is a related question in the chat also to this use or even maybe demand for the use of antibiotics, and that goes to you, Danilo. It's about the COVID, and we are in the middle of this pandemic, and one of our participants raised the question that in some European countries, I think the participant mentions England and Italy, antibiotics are advised to be used or against COVID cases. What is your view on this? And you had this infographic or information material you also showed about AMR and COVID. So maybe you can elaborate a little bit and see what is the advice from WHO in terms of antibiotic use for COVID cases.
Oh, yeah, thank you very much, Peter. Well, I think very basically, COVID is caused by a virus. So antibiotics themselves are not effective against viruses. That's the first thing. But what we see so far is that in about 15% of very severe cases, there is a co-infection, co-bacterial infection, and those, of course, need to be treated by antibiotics. But COVID itself, against COVID itself, antibiotics are not effective. So that's basically what I want to say. In case of a bacterial co-infection or the chance of a co-infection, in some countries they may actually use different kinds of antibiotics. But again, for side effects or additional diseases.
Yeah, thanks, Danilo. And if I can just add in, although I'm the moderator, I saw some statistics that it's only around 8% of COVID cases that actually have a co-infection. So the number is very, very low.
Yeah.
Okay, there is another question, and that probably also goes to all three panelists, and that's about the overall AMR situation in Turkey. What is your views on the overall situation of AMR? I think that can go from different angles, so I don't know who wants to start. Maybe can I pick on you, Mario, maybe to kick that one off? What is your perception of the overall situation of AMR in Turkey?
Well, I don't have the data on me. That's what I can say is about one sector of veterinary is very important. That is aquaculture, and in Turkey is one of the most important production. And the use of antibiotics in aquaculture is a big problem. We are still working, producing a specific network in OIE about this. And I've seen that the national action plan is not fully implemented. So I think that this is an average state. Is not in a better situation, but it still needs improvement. Like a lot of parts on this region and a part of the Europe as well. There are just I show that there are few countries that a majority of countries are fully implemented national action plan, but none of them are really fully budget. That's the problem, the resource, and maybe in the future with the COVID crisis, I don't know how. I think we need more of this awareness workshop to take this issue at the right level, because can be really a problem after the COVID if we just not fully push the action plan. And Turkey is, I think, is exactly in the middle of the situation. Yeah. Over.
Thanks, Mario. Daniel, could I maybe ask you a similar question? What is your perception of the overall situation of AMR in Turkey, and maybe even take that a step further if you have any recommendations of what could be done to improve the situation, the action against AMR?
Thanks, Peter. Yes, I think, well, I don't have any concrete data on the usage in Turkey, but the issues are and recommendations are similar to those I just highlighted in my previous intervention. I think the not using antimicrobials for growth promotion or prevention, that's probably the biggest recommendation that applies to Turkey and all other countries in the region. And like, well, I think that the testing prior prescription is also important. So like also in the veterinary world, is quite common that antimicrobials will be prescribed without knowing exactly what's the bacteria or pathogen, and without knowing if that pathogen is resistant to any antimicrobial. So I think that's another recommendation, perhaps. Like there should be it should be a more routine. It should become a routine to like test for antimicrobial resistance before prescribing, so that the best antibiotic can be chosen rather than just blankly use the first one you have available.
Thanks, Daniel. So this is really around surveillance, monitoring of the use, but surveillance of resistance in both humans and animals. Now, Danilo, you have also added here to the chat around the AMR surveillance results and the CESAR report. Maybe you can add a few words on what that report contains and how that's relevant also for the Turkish situation.
Yes, of course, Peter. Thank you very much. Well, as I mentioned also during my presentation, there's a long history in Turkey of measuring both antimicrobial consumption and antimicrobial resistance. What we do know is in the well, 10 years ago when we started with this in Turkey, but also certainly the previous years of that, the starting position of Turkey, if you will, was not very good. There was a lot of antimicrobial use, which also means that that's reflected in a lot of antimicrobial resistance. And in a way, it's not a surprising picture, because we have data from EU member states, and we can see that countries around Turkey that are EU member states also have traditionally a very high use of antimicrobials, which is then also reflected in a high prevalence of antimicrobial resistance. What has happened in Turkey since is that they really started working on the issue in terms of education, but certainly also monitoring, setting up e-prescription, being able to trace where the prescriptions are coming from and where they're going. I think these are very good steps towards lowering the general use of antimicrobials, which a while later we will see reflected in antimicrobial resistance. Now, I think we need to bear in mind that these are changes that take a long time. There's no overnight solution to this. So what I would like to say is that the things that Turkey is doing right now and the attention that it's giving to it are putting Turkey on the right path. It's just that they were very much on the high end of both use and resistance when this work started more than 10 years ago. But I'm very optimistic that we will see even more dramatic results as education efforts increase, as antimicrobial stewardship programs are being implemented, more focus on infection prevention and control, and etc. So I think that is it's on the right path, but it will take a long time. And I also am very encouraged by some of the comments in the chat that are coming from pharmacy students or doctors or nurses that represent the new generation. And if they have an interest in this, and if they are willing to withstand all the temptation or the pressure from patients, then this is also a good development, that the next generation has a better focus on trying to maintain the effectiveness of antibiotics and other antimicrobials. Thank you.
Thanks, Danilo. Now that you have the mic, I will give you another question.
Sure.
Which was raised in the chat around the use of antibiotics in migrant communities. And of course, the situation is different from one context to another, and there are very challenging environments in Turkey where the administration of antibiotics may be more complex than others. What is your advice on the use of antibiotic in these kind of communities where you have a lot of migrants gathered in small spaces?
Yes, thank you. I know actually that there's some work ongoing in Turkey about this specific issue, also because the issue around migrants is a very pressing one. Specifically, so I'm not familiar with the results on what exactly to do, but we just know that migrants and refugees sometimes live under circumstances in which it's more difficult to maintain a high level of hygiene. So what I think is most important is to make sure that both migrants and refugees have access to the health system, that they get the treatment they need when they need it, and that they also have access to preventive measures as well. But more specifically, I don't know about the results from this particular project. Maybe our host Melda knows more about it. I just think of course, it's not an issue that we can ignore, and you can also not marginalize those people because they need access to health just like everybody else.
Yeah, thanks Danilo. And I see there's a bit of discussion now in the chat around Mario's comment earlier. And just to clarify, I think there was a participant from the Ministry of Agriculture who's clarified a few points here in the chat, that the consumption of antibiotics over the last 2 to 3 years have actually reduced by about 50% in Turkey, and that there is a network among specialists who work on prudent use and measures to reduce the overall consumption of antibiotics. So I think that's important to clarify also in this context. Now, you all mentioned, I think all three panelists, you mentioned this working across sectors and working across stakeholders is very important, that no one sector, or maybe not even one country alone can work on antibiotics. So there needs to be strong mechanisms in place to work across sectors. What are some of your experiences and advice maybe you can give to Turkey on how to strengthen the multisectoral collaboration under this frame of a One Health? What needs to be in place and what can be done to strengthen such mechanisms? Can I maybe start with you, Daniel? From your perspective, what would be your advice and your experiences?
I think definitely in an issue like antimicrobial resistance, there is no question that all sectors involved need to be communicated at a regular level. I think, however, AMR is not the only issue that needs to be jointly worked at between public health and animal health. So having the right mechanisms and like to allow for this work, and like making sure that those mechanisms are formalized within the system, the general system, but also within the public health system, within the agricultural system. I think that's perhaps the key thing. I think in general, like the idea is like the whole world moves towards like within each country to a more collaborative approach between different ministries and different sectors. So I think like there is a need to have like periodical meetings to identify focal points and make sure that those meetings and this exchange of information takes place on a regular basis, so that there is a growing understanding on the issues faced by the other sector and how it operates, that you start knowing the right people by their name and so on. I think like it needs to become like a routine, let's say, for public health and agricultural sectors to better understand the issue from the other side, and to work collaboratively and to discuss problems and to exchange information on a regular basis. I think by doing that gradually, eventually, the whole coordination will become much easier. But of course, the first thing you need, apart from the commitment on the different ministries, is like a commitment at a higher level. So I think the instructions and the push has to come from higher up, and this type of interactions have to be how to say, put it into a national framework, and like have the mechanisms and have the tools officially instituted so that this can happen.
Yeah, thanks, Daniel. Mario, do you want to comment on this as well, on what you see as the success factors for multi-sector coordination and collaboration under the umbrella of One Health?
Well, there's now so much to say after, I think Daniel says more or less everything is in my mind, but I would like just to put the finger on one thing that is the collaboration is between organization is built up, is going better and better, and we have a lot of tripartite activities together, but because these strategies can make some results, the collaboration should be even inside every single country and between countries. It's not only an organization that just give idea and strategies and show the good way to reach results, but after is government and practical activity in the countries that can reach the point. So it's very important that the ministry in the countries speak each other. And as I always say, that I'm lucky because I come from Italy, where where veterinary sectors and public sectors are working in the same Ministry of Health. So for me, is already inside my mind. But I know that this is not for all the world is the same. So we need I work now in Kazakhstan, and the Minister of Agriculture is far away from Minister of Health. And so means that even in the country, even the statutory board of medical and veterinaries and pharmacists should work together, because otherwise it's just like we produce the umbrella, and under the umbrella there is nothing. That's important. Even the countries, this tripartite mentality should go on.
All right, thank you, Mario. Maybe Danilo, a similar one to you. I mean, with your experience in working across sectors and in this animal, human, and even environment interface, I mean, what are your experiences in terms of challenges and some good practices in overcoming these challenges of working across sectors?
Thank you, Peter. Well, first of all, I just want to, sort of join my fellow colleagues in FAO and Hawaii. These are, of course, the main things. You mentioned that efforts need to be coordinated. Coordination starts with communication, I think, and it's and also Daniel mentioned it's very important to formalize these structures. And I think if you have an intersectoral group or a mechanism in a country with very closely defined TORs, terms of reference, so everybody knows what is expected of them, what do they need to do, what do they need to contribute to the group, and make sure that there's this regular communication. I think also it was said very well in the beginning that One Health doesn't mean that everything has to be done together, but it means that everybody has to do their part. And this is where the coordination comes in. There's certainly things that are pure human health, pure animal health, pure agriculture, pure environment, but it's at that interface where the things come together. This is where coordination and communication is absolutely needed. And I think if you're lucky to live in Italy, and Italy is an excellent example where you have a common leadership that enables the regular communication and collaboration between animal and human health. That is, of course, an ideal situation, I would think. In the absence of that, you would still need political will and to form this mechanism that, in addition to the day-to-day, you actually have a part of your time dedicated to communicating to your colleagues in other sectors, making sure that you provide the information that is needed and you receive the information that is needed and share it again back to your constituency or to your sector. I think in practice we see, because I think the theory of a One Health approach has been around for a long time, and also in areas outside of antimicrobial resistance, of course. But just like any kind of partnership, I think it really works if you have a common project, if you have something actively and practically to do together. So I think in those countries where they are gathering data and putting it together in one report, it sounds very trivial, but just the exercise of gathering the data, putting it together, doing the joint analysis, making sense of it, and then publishing it, that in itself is a One Health activity that brings people together, has people understand each other's challenges and opportunities, and acknowledges their role. And then whatever comes out of those discussions is actually made public. So I think the political will has to be there. The mandate for people in the intersectoral group has to be there. And they have to have some sort of a common product that then is of benefit to all. Because again, there are these sort of areas within each of our area that are not One Health, that we are responsible of. But there where it really makes sense to come together, that should be documented and followed over time. So I guess the barriers are, traditional vertical structures, both in mandate and also in financing. It's always difficult to work together if the first question is, where should the money come from? And am I allowed to, spend some of my time working with you? All those barriers need to be taken away for people that actively are engaging with their counterparts to have the peace of mind that they're doing something which is useful and valued, and their time is well spent and accepted in that sense. And then I think when you have that, the rest will follow. It's as Mario mentioned, people that know each other and have been working together, they can easily pick up the phone in times of crisis, or they can get together for a number of days or weeks putting a report together. So it's also, there's a big human factor in that. And of course, we hope that the National Action Plan development would take part of that, a big part of that discussion and create that mandate. But unfortunately, we see in many countries that a National Action Plan is a plan, and the implementation part, the actual who does what, by when, is still missing. But there are good examples out there, and they are built on trust, communication, and a clear line of responsibility and accountability. Thanks.
Excellent. Thanks, Danilo. Very important point. Action plans are indeed to be used and to be monitored as they are being implemented. So I think that's a very important point. I just wanted to go back to one of our previous discussions around some of the efforts that have been done in the agricultural sector in Turkey. And I know we have a colleague from the Ministry of Agriculture who wants to share some insight and some information about the activities that are ongoing in Turkey. So I will give the floor back to you, Melda, to introduce our colleague from the Ministry of Agriculture. Over.
Thank you, Peter. Before introducing Arif Bey from Ministry of Agriculture, I would like to mention that Turkey is a little bit different country, that there is no approved action plan for more than 5 years, but there is a joint activities together with Ministry of Health and Ministry of Agriculture, and hope in the future Ministry of Environment. So I think it is a little bit unique example, implementing the activities jointly together in technical level and without very high political commitment. And I think it's very important. And from the Ministry of Agriculture now, I would like to give the floor Arif Özkan Bey, if he is available, to listen his remarks. Thank you very much, Arif Bey.
Can you hear me now?
Your voice is very low.
Sesini
We can't hear. Our translators.
we can hear very low. We can hear your voice, but it's very, very low.
Very low, but Arif Bey, sesiniz çok az geliyor.
We can hear you very low. Can you hear me now? Unfortunately, it's not audible. Can you not hear me?
Çok az.
Very low. I can hear you very low right now. I think technically we are having a technical problem. If you allow me, Arif Bey, is your microphone on your headset or on your computer? Both of them I have on my headset. May I ask you to make an adjustment on left bottom screen? There's a little arrow next to the microphone picture. Can you see that? Yes, can you hear me now? It is very low, Arif Bey. Could you find the arrow? Yes, I did, and I turned it on.
Tamam, şu anda iyi. Arif Bey 5 dakika.
Right now, it seems okay. You have 5 minutes because we have to close the meeting because our panelists have other schedules. May I ask you to speak only for 2-3 minutes only? Thank you. First of all, I'm extending my respect to you all. I think now you can hear me. Yes, we can hear you, sir. First of all, I should say that during 2015, we started to prepare the antimicrobial resistance strategy document, and the item number 5 was about us. And there was a very strong project concerning the project, and all the veterinary doctors and veterinarians in Turkey have to obey this prescription system. So from the production to the final use, including the monitoring of the residues, we have implemented this mechanism. And concerning this, we have sent a short briefing note to the WHO of country office. We believe that in Turkey at the moment there is a unique mechanism has been implemented. We can monitor antibiotic usage at the milligram level. Therefore, this mechanism can be adapted to all other world countries because this mechanism is a very strong mechanism. No veterinarian can use an antibiotic without prescription. Since 2015, when we compare it with the SWAT data, we have seen that antibiotic use has been reduced significantly, and we can keep the veterinarians within the system in a very disciplinary way, and we have guided the system for rational use. In particular, via the veterinarians guiding the system, we have reduced the usage of antibiotics by 50%. In Germany, in the ISWAP data, it was published that Germany has made the most significant reduction. However, we have made a more significant reduction compared to Germany per animal. So one of the previous participants said that in aquaculture sector there are problems. In, of course, it is possible that there are some problems in the agricultural sector. We cannot say that we have stopped them all, but in poultry and in aquaculture sector, the usage of growing antibiotics prevention is very important for us. From the imports to the last final use, all the stages, including the marketing, we are controlling the whole mechanism. Every imported raw material or final product cannot be prescribed without logging into the system. So we believe that this mechanism can set example to the whole world. We are going to strengthen it more. And besides, on the system, in particular, the critical antibiotics not being used in the first phase. There are certain mechanisms so that the vital, very important antibiotics, critical antibiotics, which have an impact on human health, will be used more prudently. Or when they are first prescribed in, they should not be used in the first prescription. So we have implemented certain mechanisms, and we have been guiding the veterinarians in this respect continuously. There is one more point that we would like to mention. In particular, one of the most important tools of reduction of antibiotic use is ensuring the animal welfare, and beyond that, doing vaccinations in a strong way. 1 year ago, in the month 8 of 2019, we have enlarged a mechanism for monitoring the veterinary vaccinations. In Turkey, in our system, we have the vaccination records of 11 billion animals. Which animal was vaccinated with which series of vaccine? So we have established all the mechanisms. I say 11 billion, including one chicken, every one of the poultry. So also aquaculture is also included in this mechanism. So for tracking and tracing is system in Turkey, all the processes are operational, and we are working for strengthening this process. In the last 2 years, about rational use, more than 10,000 veterinarians registered in the system were trained in their provinces. Besides the system, these trainings have contributed a lot to this reduction. And thank you. If you have questions, I can answer them.
Thank you very much for your valuable remarks. Now I would like to give the floor to the Peter for to receive the last remarks of the panelists, and I think we need to close the meeting in a short while. Dear Peter, floor is yours. I can't see Peter. Maybe I can ask the remarks and last remarks of the panelists. We can start with Dr. Danilo, if you agree. Thank you.
Sure. Well, I think first of all, once again, I'm very happy to be part of this great event, and very happy to see so much interest in the number of participants, and also the scale of different backgrounds. I also want to say I've worked with colleagues in Turkey with great pleasure through many years, and I know we will work together in many years to come, together with my colleagues from OIE and FAO, because despite a lot of progress that has been made, we still, of course, have a long way to go, not just in Turkey, but globally. I'm looking forward to working with you all. Thank you very much.
Now I can give the floor to Peter.
Thank you, Melda, and sorry I lost connection for a few minutes, so I'm not quite sure where we are up to now. But the last I heard was Arif's intervention and the experiences he shared and the information on the activities that are going on in the agricultural sector. Very pleased to see a lot of activity there. And I hope this discussion session and the presentations provided some input that Turkey can use to move forward. Maybe use it also as an opportunity to have the National Action Plan finalized and implemented. A lot of activities are going on, it seems, even without a National Action Plan, which is also very, very good. So I hope this session today has provided some input and a momentum to move further and even strengthen the activities that are ongoing. So with this, thank you again for inviting us, and back to you, Melda. Over.
Thank you very much, Peter. Now I would like to give the floor to Dr. Daniel Bertrand for the closing remarks and last remarks. Thank you.
Thanks, Melda. Well, thanks everyone for the attention during this time, and thanks a lot for the opportunity to talk to you about what FAO is doing. I mean, I do realize that these type of events are very important in raising awareness, which is perhaps the most important aspect of changing people's attitudes and gradually reduce the use of antimicrobials. But I think this type of efforts have to take place also beyond the Antimicrobial Awareness Week, and we have to continue raising awareness. In our case, farmers, field veterinarians, I mean, they really need to become more and more aware. So I do hope we'll have the opportunity to work more in the future on this important issue. And thanks again for having me.
And thank you very much for your participation and all contributions. And Dr. Maria Latini, I would like to give the floor for your closing remarks.
Thanks. Just to say that AMR is not an issue that there is a final point. Antimicrobial resistant is working by itself. Bacteria changed, system control changed, so is an ongoing process that we need to work together and to take at the minimum level possible. It's impossible to say to reach a level 0 where everything is done and this problem was in the past. This problem it is now and will be always in the future. The only thing is that if we work good and with a good strategy and all together, we can take this and at the lowest level possible. So, but remember that is an ongoing process that it will never end.
Thank you very much for your contribution, participation, and remarks. Now, as the last, I would like to give the floor to Mr. Bekir Keskin-Kılıç for closing remarks.
Çok teşekkür ediyorum.
Thank you so much.
Hepimizi tam da düşündüğümüz gibi bir kez daha düşünmeye, bir kez daha bulunduğumuz yeri kontrol etmeye ve bir kez daha kararlılığımızı tekrarlamaya sevk eden bir toplantı oldu. Ben emeği geçen herkese çok teşekkür ediyorum. Ortak çalışmanın getiremeyeceği hiçbir sonuç yok. Sadece baştaki sunumlarda bu ülkelerin AMR'a karşı reaksiyonlarını izlediğimiz bir grafik vardı. Orada Türkiye planını yapmış ama onaylatmamış gibi görünüyordu. Burada bir sadece usul problemi var. Açıkçası Türkiye'nin pratiğe dönüştürmek için o tür bir onay mekanizmasına çok ihtiyacı kalmadı. Çünkü inanılmaz çok sayıda izleme mekanizması sağdan soldan uçuyor Türkiye'de ve Cumhurbaşkanlığı düzeyinde, presidential level'da bir izleme mekanizması var. Hem Tarım Bakanlığı'nın hem Sağlık Bakanlığı'nın kendi stratejik planları ve zaman zaman belli süreler öngörülen genellikle 180 günlük eylem planları var. Bunların içerisinde zikrediliyor ve biz bunlar için sürekli hesap veriyoruz. Dolayısıyla her ne kadar meclis onayı yok gibi gözükse de teoride hiçbir engelimiz yok. Düşündüğümüz her şeyi yapmakta. Zannediyorum dinleyiciler de bunu gördüler. Ben bir kez daha çok teşekkür ediyorum. Katkılarınız ve bu mücadeleye verdiğiniz destek için hepimize kolaylıklar diliyorum.
Approval from the parliament either. So these are all in continuation.
And I agree that I think Turkey is a unique country because everybody has a commitment for working together, and I think there is no obstacle and any barrier to continue together. Now, I would like to close the meeting since we have a little bit late. Thank you very much for these all participants, and we hope that in the next coming future, we will see each other in these kinds of events. And as soon as possible, I hope that we will see each other in face-to-face in meetings. Thank you very much for your participation and for your all contribution and presentations. Thank you very much. Now I am closing the meeting.